Okay, this is James with the GVU MSAT program for my Gen Med for the genitourinary patient case, part 1. So this is a 16-year-old ice dancer with medial malleoli pain. Saw a physician initially, was treated for medial malleolar bursitis. Treatment did not go well. That treatment went through the same treatment twice of an aspiration of that medial bursa and a corticosteroid injection. Again, didn't do anything for her. So now she's seeing me in the clinic with medial malleolar pain. So first and foremost, what non-ortho conditions do I suspect? From the chapter, the one that really stands out to me is amenorrhea. Just kind of based on, it seems to me that this is like some kind of bone injury going on right now. And going through the chapter, amenorrhea kind of lines up with something along the lines of like female athlete triad, relative energy deficiency disorder, things like that. So to kind of like reinforce whether like I'm on the right track or not, I have a couple history questions that I would probably ask her. First, I would ask her if they have started menstruation at all, because that would differentiate from primary and secondary amenorrhea. And if they have menstruated already, which they should if they're 16, do they have an irregular period, or have they stopped having their periods altogether? And then finding out like when, for how long, like either how long has it been since you've had your period, how long in between periods could be important information as well. Another question that I would have for them is, have they ever been diagnosed with an eating disorder? If yes, what disorder? If they're comfortable sharing. And then if they say no, I would then ask if they have done any dieting recently, if they're watching what they eat, if they've been restricting their nutrition in any way for whatever reason. My fourth question would be, are they suffering from chronic unexplained fatigue? So are they just always tired for no reason whatsoever? And then my last question would be, do they suffer from menopausal-like symptoms? So those could be things that usually that women who go through menopause experience, but things like hot flashes, unexplained mood changes, vaginal dryness, etc. So those would be my like initial like 5 history questions to kind of determine kind of where we're at and what we need to do going forward. So, and then building off of that, what would be the most appropriate referral? So initially for me, I would send to a primary care physician to, to like rule out any fracture of that medial malleoli, so that way if we need to get her booted, we can do that right away. Like booted, crutched, casted, whatever we have to do, like get that ruled out as we go through some of these other things. So the second thing, and this would be working with first, like with the referral to this physician, I would also send them a message ahead of time listing out my concerns for, amenorrhea, and ask them to also do their own screening. And then after that visit, if they also are suspecting, or even if they're not, I would also like to refer this patient to either a gynecologist or an endocrinologist, or both if we can manage that. So then that for and that would be screening regarding amenorrhea, just female triad in general, and along with REDS, relative energy deficiency disorder. So, and this would just kind of depend on their history questions and things like that, along with that. And like with these screenings, they could get their bone density done, they could get a hormone chart done to like really see what's going on that we can't really do in the athletic training clinic. And then from there, we would treat as needed depending on what this team of physicians finds. Thank you.